Hello, Boots Knighton here with Open Heart Surgery with Boots, and Kelly Sadauckas is back for episode 2 of our Heart and Pelvis series. Wow, I hope if you're just now finding us, I hope you'll go back and listen to the first episode because it really does help set you up for understanding all things pelvis. I asked Kelly to start us off with 101 pelvic health, what it looks like, feels like, how it should operate, and then what happens when it goes awry. And so that now brings us to our second installment, which is erectile dysfunction.
Hey, we gonna talk about penises. This is important because, hi, I'm Dr. Kelly Sadauckas, double board certified pelvic physical therapist, if you didn't meet me in the first episode. And my goal in life is to break down barriers that are preventing you from understanding your body and the bodies of the people you love. So, most likely, you either have a penis or you love someone with a penis. So, this is going to be very important information. Boots and I were chatting a little bit, and she's like, well, is this erectile dysfunction in men and women? Which is a very valid question because, yes, we ladies, we actually have like our clitorises are actually little tiny penises. They arose from the same embryonic tissue as a male penis. So we can still also have erectile dysfunction. But guess what? This will not shock you. We don't study erectile dysfunction in ladies, and we being the scientific community at large, because we don't study anything in women because hormones, and that's bull crap. But that is the reason that most of the studies and the things that I'm going to talk to you about today are a little bit more leaning towards male anatomy, people with penises. But if you can stick with me and you can understand the science behind what we're going to talk about, it is applicable to every human. And we're going to specifically talk about the fact that erectile dysfunction by itself is an independent risk factor for having a major adverse cardiac event. Holy shit. So even in the absence, even if you have no family history of heart disease, if you exercise, you don't smoke, you don't drink, if you're having a little problems in the bedroom, attaining an erection or maintaining an erection, that is going to precede your first cardiac event by 3 years, or excuse me, it could precede a major, how can I say this? It could indicate that you might be at higher risk of having a major cardiac event in the next 3 years. So you got to get your cute pelvis, or if this is your loved one, get their cute pelvis into a cardiologist for some primary preventative screening. Okay? All right. That being said, let's dive into what is an erection and what is erectile dysfunction. So,
So you just talked about why we should care, but let's go even more basic than that. Why is sexual health important? Why should we even be talking about this? I know about the cardiac risk factors, but just for the overall picture of health and thriving as a Homo sapien.
Oh my gosh, that is a fabulous question. So first and foremost, even at the most basic level, why do we care about sexual function? Even before I talk about, the risk factors of that erectile dysfunction, sexual dysfunction sexual function can be an important part of any human's life journey, right? There are legitimately some individuals that it is not a priority, and that's fine if it's not a priority for you. You're not alone. But I would say a greater percentage of people start to lose interest in sexual activity because it becomes either painful challenging to do physically, either because the actual pelvic parts are no longer up to snuff, or orthopedically, perhaps we have back pain or hip pain and we don't know about how to change positions. Ladies and people with vaginas, as we age, our hormones change. That can be one part of a puzzle that makes intimate functions a little painful or less enjoyable. And so we might tend, rather than trying to fix the problem and make them just as enjoyable as they were in our younger years, we might tend to not do that anymore. And why that matters is sexual function could be something that you can enjoy again. And when you can enjoy it, it is a powerful bonding experience between you and your partner. It's good exercise, whether you're with a partner or by yourself. And it involves a release of endorphins that is good for overall mental health and pain management. So the ability to achieve an enjoyable climax, it's kind of a litmus test, so to speak, as far as how the whole system is working, the brain body connection for that sexual response, the physical health of the muscles around the pelvic floor to have that appropriate sexual response, regardless of your anatomy. And if we can't do that, then maybe it's a sign that, ooh, this is an opportunity for us to get a little bit better. And then we look at the science of specifically erectile dysfunction being able to potentially like be a risk factor for heart problems down the road. Ooh, now that's interesting. And if we do have open heart surgery, the recovery of that sexual function, that's another piece that sometimes is overlooked in your cardiac rehab, right? And so we want to, in later segments, actually dive into that about, sex is a endurance event. Is your heart ready for it, right? Is your pelvic floor ready for it?
Okay. Yeah, so
That's
thank you. Yeah, that sets the scene, because I think it's just so important to have buy-in, especially for those who may, like you said, feel no shame if like this isn't a topic that maybe is super passionate for you, that's fine. But it's okay to go through the emotions, feel all that you need to feel. You're all are welcome here. And this is a safe place. And I know Kelly personally, and I can't think of another person that you can safely explore this topic with.
Oh, thank you, Boots. Thank you. And, the topic's important because, if we look at, for a number of reasons, the prevalence, so what is erectile dysfunction, right? Let's take one more step back. So, hey, here's Peter the pelvis, or Philip the pelvis. Hi. We met Patty and Randy the rectum in the last segment. But here is a pelvis with traditionally male anatomy, right? In the last segment, you met Patty the pelvis, which showed you all the cool bony rings and the muscles that exist to form the base of your pelvis. And we talked about how those muscles worked along with the other body functions to control a basic pee and poop functions. Now, intimate functions in someone with a penis. Usually the penis is nice and relaxed down here like so. What is an erection? What an erection is there are these cool little pelvic floor muscles at the base of the penis. I'm blocking this hole because I can't find my male pelvic floor right now, but it's pretty much the same as this right here. But there's these little muscles at the base of the penis that when we are sexually aroused or during key times of hormonal changes, sometimes for no reason whatsoever, these muscles at the base of the penis will constrict. And when they constrict, they are preventing blood from leaving the penis, so it will engorge and form. Ready? Oh, can I do it? Oh, I don't want to break it.
Don't break so up there.
And it will point upwards. Hello. And the funny thing is like everybody's different, right? So please, whatever you look like, whether you're circumcised or not, or your partner's circumcised or not, everybody looks different. Sometimes erections are pointed straight. Sometimes they're a little hooked to the side. It's totally fine. You are normal, I promise. Okay. If you ever have a pain-free lump or a painful lump that feels like a little raisin in your testicles, then we want to get that checked out right away. But when you have an erection, it might look like this, straight soldier, or it might be a little to one side or the other, and you're fine. And I want you to know that because we don't, as with everything pelvic health, we don't talk about this stuff enough. So that's what an erection is an engorgement of these blood vessels within the penis to trap blood in there and then make the soldier stand tall and proud. That is a muscular effort, right? For
So
these muscles.
I just, and this is telling everyone. And you know, when
I'm a doctor.
You got to follow her on Instagram, because if it's like this all the time.
Really, I think one of my first posts about penises, I'm like, trouble raising the mainsail.
It's not funny. Like, I don't wish ED on anyone, but my God, let's have a little fun while we're at it.
God,
Right?
no, we have to. We have to, because you know what, Boots? Like, I am reaching, like, we are reaching people because we can talk about this and have this conversation. If we just talk so scientifically, we make it uncomfortable and we lose that chance to help someone. So that's, you know, this muscular effort of these pelvic floor muscles, again, specifically in the penis, and yes, it also happens to a lesser degree in the clitoris. They are going to constrict at the base of the penis and cause this to engorge, okay, to then potentially allow for penis in vagina or penis in something else penetration, and then stimulation of all the amazing nerves that go along with that happen. Magic happens, and we can have this beautiful, fulfilling climax that typically is going to result in ejaculation. If you've had a type of prostate surgery, sometimes it's called a dry ejaculate. Again, that's a little too in depth for this talk, but we have a beautiful, fulfilling climax. Everything relaxes back and cycle resets for the next time. Erectile dysfunction is the inability to attain or maintain that erection for the task at hand, so to speak. There are some puns, I think, possible in there. And if you were around for the first talk, we talked about how these pelvic floor muscles are like a hammock at the base of your pelvis, and they're like an elevator and a hammock. So they're a hammock at the bottom of the pelvis and have an elevator-like function, and they're meant to actually live on the ground floor of a 4-story building and kind of move up and down depending on the task at hand, but always come back to rest and even be able to relax into the sub-basement to have a good poop and then come back to rest. If these pelvic floor muscles are resting on the 3rd or the 4th floors, and we talked in the last segment about why that can happen. That can contribute to pee leaks or poop problems. But from a sexual perspective, if they're always working, if they're always clenching on this 3rd floor, and then the time occurs or the mood occurs where you need them to do a little bit more work to get this erection, they might not be able to because they're tired. You know, we use a wall sit analogy. If I ask you to go and run up the stairs right now, you could. What if I put you in a wall sit for 6 hours and then ask you to run up the stairs? You're not running anywhere. And that's what can happen in these muscles in the pelvic floor. They're too tired from being tight all the time, so they don't have the energy to constrict further to cause this erection. And then when we build, so we get the erection in either the clitoris or the penis, and then there's this building, this period of excitement before we have the release and the climax. So it's the climb and then the climax. The climb requires healthy nerves. If all of the pelvic nerves are tight all the time, all of the pelvic muscles are tight all the time, they can irritate the nerves and make the climb hard or impossible. And then to actually climax is a plyometric contraction of your pelvic floor. I bet you didn't know that. So that means it's a really fast dynamic contract and relax to have this climax feeling. If your muscles are not healthy enough to do that, you can't have a climax. Oh my gosh, or you can, but it hurts. So wow, like that's all of the parts that are required for a normal erection. And then like any difficulty with any of that is considered erectile dysfunction. Long road to get why we care on the Open Heart Surgery with Boots podcast. Heart disease. The same changes in our arterial systems that can lead to ischemic heart disease, that can lead to stroke, that can lead to coronary artery blockages. Guess what? Those coronary arteries, how big are they? Okay. Brain arteries, pelvic floor arteries. And those of you that are just listening, I'm showing the relative size. Coronary arteries are big. Brain arteries are a little smaller. Pelvic floor arteries are tiny. So they're like our little canaries in the gold mine. And the same changes in life that are going to lead to some of this atherosclerotic change, stiffening of arteries, blockage of arteries, they're going to present in these little tiny arteries first.
Wow.
So it's so powerful. And what evidence has shown is that the presence of this erectile dysfunction in a man, yes, it can be due to a lot of factors, but it can be that hypertonicity of the pelvic floor, but it also can be a primary change in the pliability of these arteries. And as such, it is an independent risk factor for a future major adverse cardiac event. And even in the absence of any other risk factors of family members having heart disease, you can exercise, you can eat well, drink well. If you're starting to have problems hoisting the mainsail, we need to get everything checked out because this could be an issue with your underlying circulation and we might just save your life. So, wow, it's crazy pants. And now if you have this erectile dysfunction and some diabetes and some family history of heart disease, or you're a smoker, or you occasionally have some alcohol or have alcohol a lot. Holy shit, friend, we got to change some stuff or you're not going to be around 4 years from now to be enjoying this beautiful life. So like it's a cool thing to be aware of because we actually can save lives when we get people to the right spot. So if you haven't been doing regular wellness checks, or maybe you have because you're watching this podcast, but maybe your best friend Bill doesn't go to the doctors and Bill and you are talking about, oh, things aren't going so well in the bedroom. Yeah, Bill could go to pelvic PT, but if they're a good pelvic PT, they're going to ask Bill if he's been to his primary care provider. And if he hasn't, they're not going to treat his erectile dysfunction until he goes and gets his heart checked because of this. And if you have been going to a pelvic PT for ED and it's getting better, but you haven't had your heart checked, you need to. It is exquisitely important. And I think earlier I might have said, but I don't remember because I say a lot, the prevalence of this erectile dysfunction has doubled in the last 30 years. And perhaps some of that is more normal reporting, but what's happening with colorectal cancer rates?
It's
They're
shooting through the roof.
skyrocketing. Okay. What things are associated with colorectal cancer? Reduced fiber intake, right? Dietary changes, all increased stress in the world, perhaps a more sedentary lifestyle, especially since pandemics, right? So all of these same things that are just killing our overall holistic health, they're the same things that might contribute to higher rates of erectile dysfunction, but underneath that, contributing to reduced health of our circulatory system, which then is, erectile sexual dysfunction, then possibly stroke or heart attack. So we need to be talking about this. It's not just about getting jiggy in the bedroom. It's about not dying 3 years from now. So it's so powerful, right?
And
Yeah.
from where I sit and I try not to watch commercials. I don't really watch TV anymore, but in the past, I mean, a classic commercial you see is for Viagra, right? And
In the bathtub.
yeah,
Hey.
it's just so, you think it's just about that, and they don't talk about any of this background you just
I
gave and
know.
like all these other things you need to be thinking about.
Totally. Well, do you know Viagra was a blood pressure medicine? Like that's all like nobody knows this, or you might, but like it's hilarious. It's like, oh, we found this amazing drug to help with your hypertension, and small side effect, you're gonna get a giant boner for 4 hours. Let's talk more about that. Like that's amazing. Like, but again, if that's the only thing, if you go in and we won't even get into the difference between males and females when we report sexual dysfunction. Well, yeah, I will. I will. if, we go in and like say a dude is like, oh, I'm having trouble with an erection. If the doctor's not educated about this research, right? And that study, I think it's from '05, Montorsi, I'll get you all links to it, in '05, that found that, the ED could pre-exist before a major cardiac event 3 years. If the doctor doesn't know that study, if they are all in, they're the best cardiac doctor in the world, they honestly might just be looking at the heart, and that doesn't make them a bad doctor, right? Like maybe they never even learned about pelvic floor in medical school. They might not know about all of those parts. So we need to educate you to take the primary steps. I got a little off tangentially right there. I kind of lost my thought.
We're citing studies and then talking about men versus women.
Oh, men versus women. Thank you. Thank you.
But I just wanted to mention, make sure, just a time out, if you haven't already, be sure to go in the show notes to sign up for my newsletter, because I will be linking to, and I'll have things in the show notes for you also, listeners. But if you sign up for my newsletter and also sign up for Kelly's, you will get these studies, and there will be more in the newsletter each of these weeks talking about why you need to care about your pelvic floor.
Oh, so, totally. Yeah. Thank you, Boots. Thank you. Time out, time in. Thank you, Boots. So if I'm a man and I come in to my doctor and I say, oh, I'm having trouble with sexual function, that doctor might not know about this important correlation. And if you look healthy, they might just prescribe you something like Viagra. And that might help this small piece of the puzzle in the short term, but you do need a cardiac workup to make sure that things are okay, to keep you good in the long run. If I'm a woman and I come in and I report sexual dysfunction, I'm not even going to lie, you will be told to just relax, have a glass of wine, which is a neurotoxin. Thanks, doc. And that's about it usually. Like if your doctor's very aware, you'll be prescribed pelvic floor PT, but there's this huge kind of difference in how everyone, males versus females, are treated in this realm, but it's important for everyone that we address. And what we can do about it. There's actual things that, if this is present, and we know that this can be an independent risk factor for future heart issues. If we're post-heart surgery, guess what? And you're having erectile dysfunction, this is still indicative that things aren't 100% awesome. So let's work holistically on the whole system. You're going to love this, everyone. It's the classic sleep, diet, exercise, and now awareness of your pelvic floor relaxation, pelvic floor general health and well-being can make positive changes to improve this erectile function, the sexual function, which then we have lowered our risk factor for that future adverse cardiac event by improving this one function, which is great. And it doesn't have to be, you don't have to be Chris Helmsworth, right? Like in the gym 20 hours a day. I think one of the studies in 2018, 40 minutes of moderate physical activity 4 times a week. Within 6 months, it reduced erectile dysfunction. So you can read that a different way if we don't care about the erection function. 40 minutes of moderate exercise 4 times a week for 6 months improves your overall cardiovascular system and reduces your risk of heart attack and stroke. And that's doable, right? And I am such a geek. I love what I do. I did a ton of teaching. I also have a new online program called Dr. Kelly's Treasure Chest that has workouts there for you, right? And I started off with 40 to 60-minute workouts. Nobody watched them. It's hilarious when you look at the data. Everybody was watching the 10-minute workouts. And you know what? A 10-minute workout done is way better than nothing. And you could do that one workout and get proficient at it and do it twice in a row for 20 minutes. Something is better than nothing. Diet and exercise, right? I don't like the word diet. I like lifestyle food choices. Generally a Mediterranean diet, fruits and vegetables, heart healthy fats. Boots, you had the whole nutritional segment, right? So they can go back and look at that. Hugely important for arterial health, heart health. So, and that's not just for today, that's a lifestyle change. And it's nothing that we have to do, but it's something we want to do because we feel so much better. And then if you do smoke, stop. Don't be an asshole idiot. Stop. There's nothing good about it. Stop. If you drink alcohol, try to stop, please. It is just as bad for you as smoking. There's no safe amount of alcohol. It's a neurotoxin and it causes mental health issues. Nothing to be good from that. Okay, so just stop. Please, we are going to be amazed when we look back 10, 15 years from now at how normalized alcohol consumption it was in the world right now. And so to help you be healthy, pre-heart surgery, post-heart surgery, eat real food, not too much, exercise, and don't smoke or drink. Okay, I think those are the
And
big
if you
things.
need help with all of that, go
Mhm.
back and listen to my episode in December of 2024 with Dr. Laura Suarez Pardo. She is a cardiac psychiatrist at the Mayo Clinic. And I asked her, treat me like I just came into your office and I'm trying to stop a habit.
Oh,
Where do we
yes.
start? And
Yes.
it was absolutely brilliant how it is just so simple, like basic small changes every day that add up to big changes. And
Mhm.
I just want to say, like, I see you, I hear you. Like, if you're listening and you smoke or you drink or have
Mhm.
any habits that aren't healthy for the body, you know what? Have you ever thought that maybe you're worthy of a vibrant, healthy life? You are.
Amen.
You deserve to be healthy and
Mhm.
ask for help, ask for support. You deserve to have a healthy sexual lifestyle. You deserve to have a healthy pelvis. You are worthy of all of this. And I
Yes.
really think that a lot of people out there just really just say, I'm not worthy. Maybe not like
Mhm.
consciously, but I
Mhm.
want to be that person in your ears that say, you know
Mhm.
what, your heart deserves to thrive, and so does your pelvis.
Yes. And so often those times when we are drinking or smoking, it's we're not doing it because we're trying to be bad. We're doing it because we're suffering and
Yeah.
we're using it as pain management and we're using it to hide the feelings, to not feel the depression and the anxiety. And so addressing those underlying factoids can help and removing that product, that chemical can set the stage for you to finally love yourself again. So good. I'm so glad that you have that podcast. Another book I love is who I forget her name. Oh my gosh, complete mind blank. It's like a woman's guide to not drinking or something. Do you know of that one? Oh gosh. Okay, we're gonna have to put the name of it in the show notes because I can't remember. Oh, Quit Like a Woman. And it doesn't matter if you're not a woman. It doesn't matter if you're, trying to quit alcohol or cigarettes or just reducing. Because again, yes, we do want you to stop completely, but even reducing can be beneficial.
Mhm.
She talks all about that, about how, and she talks specifically how about like AA didn't work for her. And I think it's valuable
That's what I needed
because
to
it
do
talks
then,
about approaching these
because I
lifestyle
was
changes from a
depressed
position of
and,
love, like you just
not
said, and not,
getting the
oh
most
my
out of life.
gosh,
And
you
AA
sus.
just for me just caused a
And
shame
I think it's really
spiral.
cool. So
It didn't work for
got a
me
little
either.
tangential
But
there,
you
but
know what?
awesome. Thank
Some
you.
of my really close friends, it
Mhm.
works really well.
Me
So
neither.
it's your own personal journey for what is right for
Mhm. Good for
your
you.
history and what you need to heal. Um,
Mhm.
just try. You deserve to
Mhm.
try. Love yourself enough to try.
Mhm. Yeah, absolutely. Mhm. Exactly. 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 Yeah, exactly. And yeah. Yeah, and I think, in my journey, I stopped like I was drinking very heavily during COVID times, right, to cope. And I mean, recognized it and then was like, oh, this is fine. It's just a coping mechanism. It's not fine, you know? And I recognized it and just cut way back and then have now stopped. And you recognize, and again, all things in my life coalesced to the point where I could make that rational decision and I had the support that I needed to do that. But you recognize that not only do you drink sometimes for me, it was to cover up anxiety that was undiagnosed for sure, and some depression that was then coming from that. But even on like just good days, it would be like, ooh, like this was already a great day. And like, why? And my total turning point crux is I was educating my kids that like alcohol is really bad for you. And yet I was still having, a couple glasses a month. And my son goes, well, why do grown-ups do it then? And I had no ration there's no response to celebrate. Like, would I have a cigar or a cigarette in front of them to celebrate? Like, there was no good answer for me to give them, and that's what made me finally turn the corner to like cut it out. um and
The
so yeah,
beauty
that's
of this
interesting. It is this whole
podcast
other
and of
level
having
of
like
just pelvic
hard
health and
stuff is
overall health.
the
But open heart
opportunity for
surgery,
puns and
alcohol
humors.
and cigarettes, they're
That's really
so
why I do it.
inflammatory. They're not serving you to heal, and they're not serving you to show up. And so there are people there who can support you and love you. And if you go to try to help, get help with these habits and you don't feel loved, then it's not the right place for you. Even if it's the right place for your bestie, that's fine. Go someplace else until you feel heartwarming. Oh my gosh, it is, dude. I'm here for the puns. All right, it's cool. But yeah, that is in a nutshell. That's why we want to talk about penises on the Open Heart Surgery podcast. And if you don't have a penis, but you are noticing changes in sexual function, this could be something to work on as a canary in the gold mine to improve your overall circulation. And if you are post-heart surgery, especially if you're diabetic, the reduced blood flow to the pelvic floor can be a contributor to pee problems, poop problems, and sexual problems. So seeing a pelvic floor PT in person or online can really help that part of your life. So please just don't think, oh, I've had heart surgery, my sex life's over. If it's something you're interested in, or, oh, I'm just getting older, I guess it's normal that I pee my pants, right? Not true. There's help available. So I have a great blog with lots of information. You can work with me or one of my staff online. I have a blog about how to find a PT near you. You can reach out to Boots or me if you need help finding a PT near you. And like I said, my treasure chest really is a good trove, literally a treasure chest of exercises to get yourself moving to improve this blood flow for not only better sexual health, but better overall health as well. Oh, and we're giving you guys a coupon.
And Patty the Pelvis and Randy the
OHS
Rectum if you missed the
2025
first
Open Heart Surgery
installment.
2025 will give you guys
I'm
25% off
telling
any
you,
of my online programs,
we were having so much
including
fun during Heart Month.
25% off the
And
first
thank you,
3 months of that
Kelly.
Treasure
All
Chest
that you
subscription, which
need
is
will be
already
in
a
the
killer
show notes.
deal.
Again,
And that goes
be
over
sure
how
to
to
sign up for
connect
the
and relax
newsletter.
to your
That's
pelvic
another way to
floor,
stay
as
in
well as
touch.
these
And if you
exercises to
haven't, make
help
sure you
improve your
hit
blood flow.
subscribe.
So
And you know what
I'm
will
glad you're
really
here.
make my
Boots, thank
day
you so much for
and
this
my Heart
opportunity to
Month
talk
and my
about
year would be
Peter the
as
pelvis.
soon as you're done listening to this episode, do two things. Share this with a friend, perhaps one with a penis, or someone who loves a penis, someone with a penis. And then secondly, leave a review. I would so appreciate that because that is how people find this podcast. So in case no one's told you, yep, blow up the email, please. We love questions. But in case no one has told you today, I love you. You are loved. You are worthy of a thriving pelvis, healthy pelvis. And be sure to come back next week for more pelvic wisdom from Dr. Kelly.
Definitely. And ask us questions. Ask us questions. Bye.